A performing arts theater is a unique and very special building with its complex, sophisticated lighting and sound systems, backstage dressing rooms, lofted fly space for set screens, rehearsal rooms, and audience seating space. There really is no comparable building.
Nearly 3 years after leaving his last broadcasting position as a commentator at the Pacific News Center, Jon Anderson remains one of Guam's best-known and best-loved media personalities.
I walk the top of the driveway at least 3 or 4 times a day.
Okay.
I go up there to get the newspapers. That's how I start my day.
Today, at 75, Jon is living with Parkinson's disease, an age-related degenerative disorder of the central nervous system. Unlike Alzheimer's dementia, Parkinson's primarily affects movement and speech, not cognitive functions.
But it's very hard psychologically for someone who spent an entire career in the media to suddenly have to stop talking. I made my living as a broadcaster, as a radio announcer, even in high school. When I was still in my hometown, I worked as a radio guy. So that's been the hardest thing for me to adjust to, is the inability to be a radio guy anymore.
The symptoms for Jon became noticeable in 2012 and got progressively worse until by 2015, his ability to walk and talk was severely impaired. Recently, however, his condition has noticeably improved.
I'm doing better now than I was a little while ago.
That's because last year, Jon underwent surgery at Queen's Hospital in Hawaii to stop the shaking and improve his ability to speak.
I had what they call deep brain stimulation. It involves a neurologist drilling 2 holes in your skull and dropping some leads into the brain.
Very fine wires with electrodes at the tip were implanted into his brain. The wires are connected to extensions that run under his skin behind the ear and down his neck to a pulse generator under his skin on the right side of his chest.
Pacemaker type unit here. This is not a pacemaker though.
What does it do? What's the purpose?
I have a programmer, which I haven't used yet, but I have a patient programmer, which I can use to tune this thing and change it around so that I can tweak it.
And what does it do? It sends stimulation to your brain?
It changes the stimulation to the brain, yeah. It's cut down the shaking and improved the speech. I think I'm stronger now speaking than I was 3 years ago.
Jon now comes to GRMC twice a week to work on improving even more with physical therapist Mark Pagaduan. Mark was raised on Guam and graduated from the University of Santo Tomas with a degree in physical therapy.
So, Mr. Anderson, to be honest, he's very, very functional. So, you know, with him, it's basically just some routine exercise to keep him from degenerating as it is, because Parkinson's, it doesn't necessarily have, we don't really have a cure for it just yet. We don't have something that we can give him and the Parkinson's will go away. So what we want is to keep where he's at, keep that good condition where it is, and then keep it from coming down any further.
I need to get into a regular program of exercises and coordination so that I can improve. My posture is not good. I have balance issues all the time. I have to be careful that I don't fall down.
Our goal is to pretty much change their lifestyle so that they can have the best function, the best way of overcoming these things and just live a better life.
You asked us to talk to you about this. Tell us, why do you want to share your struggle with this disease?
Because that's what I do. That's what I did for a living for 30 years. I'm a public person. I don't have any problem sharing my problems with the general public. If I can be of help to anybody, if there's anybody out there that is dealing with Parkinson's or at this stage of Parkinson's, I'd be happy to work with or even meet them and talk to them. I wanted to start a Parkinson's Association here. I haven't given that up. I want to tell people that if they have Parkinson's or the incipient initial stages of Parkinson's, they should investigate this surgery It's called deep brain stimulation. Parkinson's is a degenerative disease, and it's a progressive disease. It doesn't get any better. You're never completely free of it, but you can hold it off. And you can do some things to alternately. For example, I can do some exercises. I can open up my arms.
Couldn't do that before?
No.
So you are better off for it.
Yes, definitely. I feel pretty good.
To learn more, call GRMC at 645-5500 and ask for our rehabilitation department or the neuroscience department.